case. Just go ahead. Read it. Have me read it. So have you checked your pronunciation too?
So let me try.
Yeah, go ahead.
A 20-year-old female is brought to the emergency department by her colleague roommate, who states that the patient vomited all night.
Forgot the ending sound. Roommate, yeah.
Yes. And she has diabetes, but after a party at their dorm, the refrigerator was broken. She tests insulin and has been injecting according to her schedule, glargine, Lispro, but her sugars have been rising steadily. Her last IQ check was 110. She stated that it was no big deal, but since then has been vomiting and is now a little lethargic. Yes. Examination reveals an ill-appearing woman. Her temperature is 37.6. Blood pressure is 118 per 78. Pulse is 160. And respirations are 30 per min. The patient's lips and mucous membranes are dry. There is fruity odor noted to patient's breath. Physical exam is otherwise normal, with clear lung sounds. And
here lab test.
Then
so you read the lab test, means you don't need to read all this. You read the result of lab test. What you see abnormal here?
Okay. The result is urine analysis is positive for ketones, but negative for leukocytes, esterase, and nitrates. What is the first best step in this?
Dissociation. You know dissociation meaning of this patient?
This patient means management.
Khi mà đụng tới, when we talk about resuscitation, it means a critical situation. It's a severe situation. They have to go to ICU or some kind of that. Sometimes we do many steps for monitor. And okay, for the lab test here, we do what? We do the test here. We do the urine analysis. Okay, yeah, and I think this blood. How can I say? Keep the blood test to. They see here we have the hyperkalemia. We have hyponatremia and hyperkalemia. Okay, so the lab test we see here. The bar gas is also low. Actually, this is acid, ketone acid, metabolic acidosis. So this is blood gas. I don't know, this blood gas here. Yeah. Air blood gas. ABG. Khí máu động mạch. So we also need a little bit time to read the ABGs. And actually, I give the conclusion. This patient have the metabolic acidosis, like because of DKA means like diabetic ketoacidosis. Đái tháo đường toan ketone ha. So that's for the lab test. So any new words here, I don't know? Or you know all of them? You can understand the question? Okay?
Acoustic.
Hello? Speak louder, I cannot hear you.
Sorry. Her IQ check was 310. What is IQ check?
Where is it?
In the middle of the paragraph. Yeah, here. Accu-check.
Actually 300.
Check for blood glucose.
This is check blood glucose with it. There's the machine. They call it the machine. Like they check it by the fingertip. It's it's not a machine. It's a equipment. You know what it? Like every
Yeah, yeah.
diabetes patient will have this at home. They check it.
Yeah,
Mhm.
the word is a bit strange. Accu.
They call the name. This is made out of wheat.
Yeah.
It's an AccuCheck. This is the name of that. And
name
when you
of
check
the
it,
machine.
yes. And that's it. That was 310. Has really high. Number is really high. So now you guys understand well about the questions. So we come to see. So first, we make diagnosis what the patient situation patient have now. This is you can see those okay in the emergency room or it's ICU more than in general because it's a diabetes emergency. Yes, diabetic emergency diabetic emergency là cấp cứu những trường hợp mình đái tháo đường. You can see those cases like this in emergency. So what the patient have now? Well, so what the diagnosis you can give the patient now?
Oh, I think this question is this. Okay, I'm thinking about DKA. Hello? Can
Yes,
you hear
yes.
me?
Yeah, go ahead.
Yes, I'm
DKA, DKA, you say DKA, right?
Yes.
Yeah. Yeah, diabetes ketone acidosis. That's true. And the blood glucose really high, ketone in the urine, and the acidosis situation condition. So what the next step we can do for the patient?
In my opinion, we should do the intravenous insulin.
You start with intravenous insulin.
Yeah.
So what you expect when you start with insulin?
I have read that it is the first step in case
Management.
of what? I'm sorry.
Management. Management like patient management. First step for management nghĩa là cái bước đầu tiên để quản lý và để kiểm soát.
Yes. And this person has a hyperglucose. Oh, sorry, I forgot this word. Hyperglycemia. Yeah.
Yes, hyperglycemia. Yes, that's true.
So we need to supply the insulin via venous.
You want to start with the insulin?
Yes.
So the expectation we will start with insulin. We want insulin bring glucose into the cell more than stay in the blood, right? Because the insulin, the role of insulin, like they take glucose from the blood to the cell. Yeah, please go into the cell. Stay in there. Don't need to go to blood. I don't want to see you in blood. Okay, that's the purpose of that. It's simple, but for the whole mechanism, it's really long. But I'm talking about a simple way to help you know the purpose when we use insulin. Sometimes we call insulin to reduce the blood glucose. What does it mean reduce? Reduce means like to bring glucose from blood to the cell, into the cell.
Yeah,
the cell.
right.
Yeah, just that. So how about the others? How do you think?
I think the first thing I'm gonna do is I will inject some fluid into the patient.
Don't give the fluid.
Yeah, and I want to Sorry, I forgot the word. Chỉnh.
Dehydrate. You got correct. You can
Yeah,
to correct the electrolyte.
Yeah, I want to
Yes, you can
correct
use
it.
this word. Correct electrolyte.
Yeah, correct electrolyte first.
Mm.
But I learned I have learned if the patient have hyperkalemia,
Mm.
we because potassium in glucose has this will go into the cell when we have a lot of insulin when we have insulin and so
Good.
if we inject the insulin and
Yes.
glucose go into the cell and potassium go into the cell too and so the hyperkalemia will not severe like this and it will reduce at the same time. So after that we can correct the potassium again. I
So
think
you want to
we will
start? Yeah.
because I want to give the patient normal saline but not potassium. I just want to give normal saline and then insulin and then potassium again.
Great. Yeah, that's great option, huh? But so what the final choice? Finally, what you choose?
Finally, I will so I will
Make decision, doctor. Make decision. Insulin or water or is this a saline? Huh? This a fluid. Huh? What you choose?
insulin.
Give me something. Okay, you give me insulin. Thank you so much. Okay. How about the others? How about Trang or Nguyen?
Okay, I also consider two options like we. First, when I read this case, I kind of think about the most intravenous free bolus with normal saline and potassium, because this patient, I think that it is my this is my option. But I also consider that this patient have a little bit of mild hyperkalemia. It's a 6.4, right?
Yes.
But she's still in the condition of dehydration.
Yes.
She has a deep and fast breath. The membrane, the mucous membrane is dry, and she's a little bit lethargic, right? And she has significant symptoms of dehydration, and we need to bolus fluid for her to increase the external fluid. But we need to kind of be careful with the potassium. I mean that it's better for her to bolus sodium
Bolus. Yeah, bolus.
with no blood potassium. But we have no option here. So I think that we still choose the first kind of intravenous free, but we should be careful with the hyperkalemia.
So you start with mannitol?
I think that's a mannitol. Maybe.
Are you sure you know about mannitol? What the purpose? What the mechanism of mannitol?
The mannitol, they often use the mannitol to get the fluid from inside the cells to the outside. You know, yeah.
So are you sure you kill patient or you have patient?
But this patient she's not kind of have edema inside the cell, so we should not do the mannitol. I don't know how to say.
Okay. Okay. First, I want to clear about the mannitol first. Mannitol we call this like how can I say osmotic diuretic. The name is like tiểu thẩm thấu. And this used for diuretic. so you want to wash, you want to give water outside the body. I mean, like for the diuretic too, the mannitol. So what the condition we should have now? We should have dehydration, severe dehydration. So you mean like you put all the fluid outside? Are you sure? Are you sure you have them or not? Because you need to know clear about the mannitol and the indication là chỉ định ha. The indication of mannitol. The mannitol, when you use it, it decreases about the intracerebral pressure. Intracerebral pressure decrease in case patient have the increased intracerebral pressure, nghĩa là tăng áp lực nội sọ. Nó sẽ use mannitol for decrease the intracranial cerebral. Maybe it's an cerebral. You know that word, right? Okay, pressure. Okay. This is hypertonic fluid, nghĩa là dịch đẳng trương, dịch ưu trương. If you see the cell keep continue lack of fluid, worsen the dehydration of patient dehydration. Bomb, kill patient direct. Sorry, doctor. The patient died already. Okay, I understand well, you guys. I'm really appreciate that you try to give fluid. I know that because you know really well how the condition of patient now. Patient have severe dehydration, actually because of ketone acidosis. And the ketone in the urine is make like high increase the osmotic in your urine. It's also because the dehydration. You know dehydration, right? Right? Everyone know about this? Okay, nghĩa là bị mất nước. So why we have to so now we have to we make confused. So which thing we start first? We start with the fluid first, or we start with the insulin first, right? That's a question. That's a question for help us to in the emergency case like this, because the start first is really important to save the patient, right? Maybe this the other choice we can start after maybe 1 or 2 seconds or maybe 1 minute. It's okay, but the first step is really important. So which thing, fluid or insulin? Actually, in the general, when we ask us about compare between the fluid and insulin in the same time, it's really difficult. And in reality, they will do together. They will do together. They give one line, they give fluid, and the other line they give IV insulin. For this case, they will give the IV insulin. Because it's a severe case and have the need as fast as possible. So the IV insulin, so they have 2 lines and they give together. But that's the question, and actually they help us to eliminate the other choice because they give the potassium together. Okay, they give potassium in this the option. Need intravenous fluid bolus with the normal saline and potassium. For this case, we should not give patient potassium because the hyperkalemia. Don't put them into the severe hyperkalemia, right? Because now we start with potassium, so it means like we increase potassium again. We don't have the insulin. You didn't start insulin yet, so the insulin still lack up, and the patient still have the hyperkalemia. So if you start potassium now, it's wrong. So you only have one option. You give the insulin, intravenous insulin. Only one option here. And the intravenous insulin, and they can do together with bolus or the normal saline. And like one said, which I don't remember, maybe one of V, like the insulin can have shift the potassium and the glucose into the cell. That's a benefit because now the patient have the hyperkalemia. You want to decrease the value of the potassium. You want to shift it into the cell. So now when we start with the insulin, the benefit to nghĩa là một con mũi tên trúng 2 đích. Super purpose. You shift the glucose into the cell. You shift the potassium into the cell. Good. And you can start with the fluid together, or after 1 or 2 seconds, it's okay too. It's not change the outcome. Huh? It can have, it's a support. Huh? Okay, so you clear about that. But in some case, after that, you have to monitor the potassium. You have to put your eye in the potassium for those of case, because it will change. Sometimes if you overuse the insulin, it can bring the potassium so down. So it can be hypokalemia, you know. So put your eyes into the potassium level and check it continuously or monitor really closely. And check with the blood glucose and check with every the ABG, I mean air, blood, yes. And see the condition patient is the acidosis or metabolic acidosis, or this the condition is can be so we have to check it, right? Okay. So if have some case, if the patient like the hypokalemia, some kind of, I don't know, so have to you make decision based on the patient. They give us 3 options: fluid, insulin, and potassium. So which you choose based on the patient, the condition of patient at the moment. You can start with those of things. It depends. Huh? I cannot say always you give insulin. I cannot say always give fluid, or you can always give the potassium first. So what thing you start first depend on the condition of patient. But there are 3 options, and depend on, because every condition is also really a severe, like it's a emergency. Huh? If the patient have the hyperkalemia, it can bring the arrhythmia, right? Arrhythmia. So it can be not good. This can be the life threatening. Huh? Life threatening là cái đe dọa mạng sống. So you have to check 3 of this together. Okay? Any question for that? You guys, any question? Okay, so why they give the negative of leukocyte, steroid, and nitrate? What they want to eliminate, and can help us to eliminate option 2.
They want us to eliminate the infection of the I forget the word.
Urine tract
infection of the
urine infection. We call the name is UTI. Urine tract infection, and they have eliminated the intravenous ceftriaxone azithromycin because they use for the infection in the UTI, urine tract infection. Yeah, they give negative of leukocyte, steroid, and nitrate. That's a 2 value to give the confirm the diagnosis for UTIs. We do a lab test. You can see that. But you are really good. You are really good. Can know about really well about what can we start when the patient with emergency case like diabetes emergency, diabetic emergency, and this is with the insulin management, or like with the DKA diuretic ketoacidosis. You can know well about the option we can have. That's really good. So today I just delivered to you guys 2 things about the test to make the diagnosis or screening test for the diabetes patient. The second, how can we manage the diabetic emergency case. In general, like I could not say all of this, but it's just like one message from that, just that. Okay, so that's it. So any question for today? From my side, it's finished. Okay, you guys ask me something, or ask a question, or tell me about the next topic you guys want to discuss. I am willing to listen from you. Hello. Say something.
Maybe we can learn a little bit about Dermatology, skin conditions.
Dermatology, great. That's a really interesting topic too, because you guys have to look at a picture a lot of
Very
picture.
difficult.
Difficult? Really difficult?
Yeah.
Yes, really difficult, really challenging because it's always get a picture. What's the picture? You have to remember about description of the picture. Sometimes I cannot remember all of them because even when I see the picture, even when I read the description, I feel, oh my god, what they are talking about.
Yeah.
Okay, but don't worry about that. It's a question, so you always have
It
to
will be
be.
interesting.
So dermatology, I will choose topic. What? Because dermatology is really big, like sometimes I feel like, oh my god, they have 100 is how can I choose that? But I was specific. So how about the herpes? 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 Nothing like
Yeah, yeah, yeah. It's very common.
yes, herpes. Start with herpes.
Yeah.
Okay, so actually, in the herpes family, they have nine types. Usually, we just know two types, XSSV1, XSSV2. But in general, they have the 9 types of that. Let's start with that. It's really interesting things.
Yeah.
Okay, so start with the herpes, and we'll see you guys in next time on at 8 p.m. Saturday. Sometimes many people ask me take this it's a golden time because sometimes people say in this time we can do many things and you free that time so can I say no, I have fixed schedule every week. Sometimes I feel how can I maintain this a longer time. Yeah, but keep going in as much as we can.
Okay.
And yeah, and if you guys have any question, just ask me or ask on the Facebook or something like that, or yeah, any discussion or some topic. Okay, that's enough for today. So see you guys next time,
Yeah.
and have a nice weekend and good night too.
Have a nice weekend.
So much.
Okay, bye bye. Thank you so much for attending today.
Bye.
Bye
Thank
bye.
you.
Bye bye.
Bye.